Hi guys, Dr. Gary Cervone here with Cumberland Chiropractic and Sports Medicine. Today we're going to talk about a very specific cause of shoulder pain, and that's shoulder impingement syndrome. So if you're an athlete that's got a lot of shoulder pain when you're throwing, or a click in your shoulder every time you move, or you just work with your arms over your head a lot, like you're a painter rolling a lot of walls and ceilings, or a plumber working under a sink, stick around because this video is for you. So what is shoulder impingement syndrome? It's a pinching of one of the rotator cuff tendons as it comes down and attaches to the arm. So what the rotator cuff actually is it's a combination of four muscles. So there's three muscles on the back of the shoulder here: the supraspinatus that comes down, the infraspinatus that comes around the shoulder, the teres minor that comes around the shoulder also, and then you actually have the subscapularis, which is on the bottom side of your shoulder blade and attaches to the inside of the arm here. And all those muscles together work to rotate the arm, hence the name rotator cuff. So like we talked about, shoulder impingement is a pinching of one of these rotator cuff tendons as it comes down and attaches to the arm. Most times we see it in this kind of blue tape here, the supraspinatus tendon. So what seems to happen is when we have an injury to the shoulder, a lot of times the supraspinatus tendon gets injured and it gets weak. And when it gets weak and we go to move our arm, it doesn't get the shoulder joint centrated into the socket very well. So what happens is the big deltoid muscle over top of it tends to do a lot more of the work, and it rides this shoulder up instead of keeping it into the joint, and it pinches this tendon as it passes under our collarbone and this little hook of our acromion on the shoulder blade. And a lot of times that's very painful. Every time you come up or you're doing a lot of repetitive overhead work, it gives you that really naggy, sort of achy shoulder pain that kind of lingers. And then we get in this bad cycle of injury, not using it right, more pinch, more injury, more degeneration, and over time that tendon just kind of gives up, and that's where we see a lot of rotator cuff tears start to happen. But a lot of times we see this as just a click in the shoulder when it first starts. It's not necessarily painful. So if you're noticing a lot of clicking, maybe some slight achiness in the front of your shoulder when you're doing a lot of overhead things, this might be something that is starting to come on you a little bit. So if you or someone you know is starting to have some shoulder pain, or you get that naggy repetitive click in your shoulder, come on in, let us take a look at it. We really want to get a handle on this thing before you get into that repetitive injury cycle and it starts to lead towards rotator cuff tears, labral tears, or neck pain. A lot of the research is showing even if it is a small rotator cuff tear, that conservative management is the best option for that. If you like this video, give it the thumbs up, leave a comment, ask us questions. We love when you guys ask us questions. Share it with your friends and family. This has been Dr. Gary Cervone with Cumberland Chiropractic and Sports Medicine, where we get you better faster.